So first, we were going to start with Benito Pérez from Transportation for America, the policy director, and then we will go to Anna Ricklin, who's with the Fairfax County Health Department, and then Sheila Somashekhar from the National Center for Smart Growth and the Purple Line Corridor Coalition. So that is all the moderating that I'm doing today. Everyone else will have some really fantastic presentations. Thank you so much.
All right. Good afternoon.
Good afternoon.
At lunch, made you a little sleep. Let me try that again. Good afternoon.
Good afternoon.
All right, we're all awake. Awesome. I'm hoping the folks virtually can hear me. Otherwise, I'll see in the chat or someone tell me. All right. Benito Pérez, Health Director, Transportation for America. We're part of Smart Growth America, which is a national nonprofit organization that its North Star, no matter who you are, where you live, you should be able to live in a community healthy, prosperous, and resilient. And I can go on and spiel about who we are, but because of the sake of time, I'm going to jump right into it. And when I start any conversation on transportation, I always start with this fundamental question: is who in the world are we designing our transportation system for? And I encourage you to take that question with you at the end of the day when you're dealing with decision makers. We'll get down there later, but take this question with you at the end of the day. Because usually it's going to be a question of, is it for vehicles or for people? Because you'll hear things about level of service and congestion relief. Where's the people? Where's people that are aging in place, children playing on our streets, people with disabilities, people that have been historically marginalized from mobility freedom? And those people belong to a diversity of communities from New York City, Salt Lake City, to Montpelier, Vermont, Wheeling, West Virginia. All of them don't look the same. They all have the unique characteristics based on those individuals, those people that live in those communities. So regardless of what community, there's ongoing transportation challenges in this country. We have a national roadway safety crisis. We have people that are being killed on the road. If you take the United States out of the equation, the rest of the world's getting safer. You throw the United States into the equation, then the entire world is getting unsafe. It's insane that we're doing worse than Colombia and Serbia on our roadway safety. Then there's also the issue of the lack of mobility choices. Whether it's, kids getting to school or this relative of mine in the bottom right, she just turned 105 last month. But she's homebound because, the nearest grocery store is a 20-minute drive in southern Puerto Rico. Just to rely on relatives that come from San Juan to take her to the grocery store. Compared to, some places around the world, she could probably walk down the street, get her necessities and also her exercise at the same time. She can't from where she's at, which in turn means there's also accessibility challenges for people that can't or are unable to operate a vehicle. In addition to the fact that we also have climate change implications from transportation. You probably remember 2 years ago, the forest fires. That also had implications for people that are cycling. Myself, that was not a great time to be cycling, but that's how I get around. And also those that anyone from Western North Carolina. I'm sure you all know what happened last fall with Hurricane Helene, and also because of that event caused disconnections in people's mobility. So we're talking about climate and transportation. That's why we're all here. If you didn't already know, transportation accounts for a third of emissions in the U.S. economy. We've made improvements. I don't know why it's that bad. Sorry about that. We've made improvements in vehicle efficiency. We also have made investments in other mobility solutions, bike, ped, passenger rail transit. But in the vehicle space, we've gotten more efficient, and yet it's getting worse because land use decisions, transportation decisions we've made, people are driving farther. And you think, well, why is that getting worse? Well, you're driving more, regardless of the vehicle efficiency. You're only the tip of the iceberg. You're dealing with
and natural
disasters. You're dealing with building the road. That has also emission implications. So is transportation tackling climate? If you may not know, we have, you may have heard the Infrastructure Investment and Jobs Act, or bipartisan infrastructure law. Senator Chuck Schumer was like, this is a climate bill. Well, breaking news, it's not. Because our friends at the Georgetown Climate Center did some modeling, as the bill was coming out. We did some analysis afterwards. I'll get to that later. Status quo is on the left, more highway expansion, which is actually what is happening. So you're just increasing emissions. We haven't changed much. Versus if they really wanted this to be a serious climate bill, we should have seen investment in other solutions and not be worried about highway expansion. And that means in our communities, like the difference of, destinations being proverbially 2 miles apart, where it's reasonable to walk, bike, transit, drive, versus what you might see in the rest and what we see in a lot of communities. Everything's spread out, so in some places it's not feasible to bike, walk, transit, and leaving people from mobility and economic choices. Overarching on transportation is design our system for the 9 to 5 downtown worker. Is that the reality we live in though? Like, we have the third shift. We have people that live, work, play. We're all not commuting every day. We're not. We have other uses in our community. And yet our system is designed for that 9 to 5 downtown worker. So there's a huge disconnect. And I share that because there's a process called Surface Transportation Reauthorization that is underway now. There's actually 2 hearings last week on Capitol Hill about this. And I highlight why it's important and hope to get your awareness of this because, we will talk about caring about the climate, equity and those things. And they'll create a little program here and then the little plans, but then they'll keep doing the status quo, same thing over and over again, in addition to state flexibility. And then what we're left is with some of us just, with a poor guy with a little shovel trying to fill in the dirt, mitigate all the past harms, but yet we keep the status quo and just digging a bigger hole. Transportation does not live in a silo, but somehow we plan for it in such a way that it is. We shouldn't be doing that. I'm sure it's probably the same case in your field of public health, housing, land use. And yet, by the fact that we continue to treat these things as a silo, we perpetuate these holistic livability challenges. So hopefully through this conversation, we can find ways to break down those silos and have a robust conversation how we tackle this together. And I say that because this is actually my former employer, redacted years ago. Do you see any health professionals in the room? The answer is no. There isn't any. And they're making big changes to the transportation system in the Norfolk, Virginia Beach area that does have health and climate implications. They're not represented in the room. I remember we were working on a Sustainable Communities Regional Planning grant there, and we actually brought the health department for the first time. They're like, thank you for actually saying hi, hello. We have plenty of thoughts. So I definitely encourage you to, when you go back to your communities, your local metropolitan planning organization, your state DOT, even your city council, be like, hi, I got some thoughts here that could help improve health outcomes in the transportation space. And, there's those various levels from the federal level down to the local level, and everything's underpinned by the public through the voting box or the community conversation, the newspaper, the press. So, as I wrap up, because I want to be passing it to my colleagues here, a more refined conversation. I do not know why these are looking poorly here. Hopefully the one you will get will be cleaner. Some resources I want to highlight: Dangerous by Design, the report that we put out, Smart Growth America, every 2 years to highlight the roadway safety crisis, looking at trends and statistics, top 100 metro areas. Every metro area has gotten worse. There, you would hope, with improvements in, conversation on safety, more money, or it's getting worse. And there's always a conversation about the user behavior, the people that's walking, the people that are driving. It is unsafe road design that continues to perpetuate this crisis. And the second thing is the larger and larger vehicles we're seeing on our streets. And there's a lot of stuff I might have thrown here. You might have heard me talk about level of service. What is that? We have a resource called Community Connectors Hub. We spend time to help dissect or decode some of these issues. Some of this might be new to you. So you have at least a working knowledge to engage those transportation decision makers, and some stories as well to pinpoint like, well, they did it over here in Greenville, South Carolina, for example. This other report, Divided by Design, talks about how a lot of communities were, adversely impacted economically, culturally, by health, by the transportation decision. We did 2 case studies in Atlanta, who bore the brunt, and some recommendations. How do we undo that? And that iceberg. Sorry, I'm going through this very quickly. This report's the one where you'll find the iceberg image that I showed earlier. This goes into the weeds about how land use and transportation are interconnected and what we can do to reduce those emissions. And then this report that just came out in November is actually looking at investments in the infrastructure law. The other one was a model exercise after the law passed. This was done like 2 months ago, looking at 3 years worth of data, and for the most part, everyone is not doing a good job in trying to reduce emissions. But you see some weird spots like the Dakotas, you're like, why them? Well, then Governor Doug Burgum in North Dakota was like, we're not growing, or we're growing but not. So I can't justify expanding our roadways and yet not maintain what we have. So let's focus on maintaining what we have. And that's hopefully the mindset we need to see more of than what you may see, like, for example, in Texas, just they're paving over the entire state. Which then gets to my other point, the congestion con, because they say one more lane will fix all the problems. There's places that pick on Detroit. Their population has shrunk, yet they increased lane miles and the congestion went up, I think, 45%. And we looked at the top 100 metro areas, and this is a summary of all the 100 metro areas where 32% increase in population and yet 144% increase in congestion. The math ain't mathing. So this is a big con here. And the last thing I point to is this report with Traffic Ahead, which basically talks about the economic sense to do multimodal, multi-land use solutions, leads to better economic outcomes. Because some of this conversation, we're looking for better health outcomes for some of these decision makers. We're going to have to talk about it in dollars and cents. So this is a resource to then also point to that. With that, that is my time. How you can reach out to us for more information. And with that, I will pass it on to Matt.
You don't even like, you can just talk. Oh.
I would project, but.
Wow, okay. Well, I'm sure we can put up some of those slides again during the conversation after presentation, because those were all amazing resources that I encourage everyone to look at. I look at those resources when I'm doing some of my work. So my name is Anna Ricklin. I'm the Health and All Policies Manager with the Fairfax County Health Department. And I'll talk a little bit about what that means in the course of my presentation. But first, this is another way to think about what Benito was just saying. When I think about transportation and health, I think about the impacts of transportation in kind of two big buckets. One of them is the emissions, the particulate matter, the pollution, et cetera, that are coming from transportation, the whole sector, the tailpipe. And then we also think about safety as affecting human health. Car crashes, pedestrian crashes, all of those impacts on the safety of our bodies that come from transportation as well. And these are some very common specific tactics that are used across the country and internationally to address how we can reduce in the case of emissions and improve in the case of safety. So eliminating free parking. If you don't have free parking, maybe you'll take transit to your destination. Maybe that'll be a few less cars on the road. And of course, then transit is supported and then transit is more successful and viable. Institute parking maximums. Instead of saying, we're going to plan to have a parking lot the size of the day after Thanksgiving shopping, we're going to plan to have a parking lot that's maximum X. Everyone else is going to have to figure out how to get there. People are going to have to get used to limited parking options. That, of course, reduces greenhouse in many ways, including less pavement on the parking lot. Obviously, improving transit service. This is really important. We could have, a 10-day lecture on transit service and the importance of efficiency and high quality, but we need to significantly improve transit service, and this should be significant talking point in any conversation about transportation. And then we need to really build safe infrastructure for biking and walking for the purpose of getting people out of their cars. And then, of course, it has to be safe so they're not hit by a car while biking and walking. If people are biking and walking more, they're driving less. Obviously, there's physical activity benefits that we all support. On the other side, improving safety. Shrink the size of intersections. If there's a project to build a new thing, maybe a hospital, often the transportation analysis is going to say, this new big thing is going to induce more traffic. And so because of that, we need to widen the intersection next to the new big thing. Well, that's only producing bigger intersections that become less safe for people trying to navigate them outside of a car, and honestly, less convenient for anybody in a car too, right? We all think about these super wide, super big intersections, double lefts, the worst. We need pedestrian scale lighting. Pedestrians are not lit when they're walking the street. So if next time you're driving, wherever you live, see if you can spot pedestrians on the sidewalk next to the road. They're invisible at night. They are invisible as they step off the sidewalk into the road. That's when they're hit by cars. We need to reduce speed limits and we need to reduce speed. To the point, roads are designed to help drivers go fast. And when you see an open road, you're just naturally going to speed more. When we have more items kind of cluttering in the street, even just a tree, not in the street, next to the street, that can help slow down. And when cars are going slower, people on foot and bikes are safer. Doing road diets is part of that. Narrowing roads instead of bloating the width of roads. And then finally, building safe infrastructure for biking and walking. Do you notice a bullet that is the same between both of these columns? So those are really specific things that we could be doing through policy actions at the local level. In most places, most of these things can be done at the local level, in local code, through transportation planning. It might not even be a big P policy, like having to go through the legislature or your board of supervisors or your city council. Sometimes these decisions can be made simply at a staff level. So I also have my unsafe picture. This picture is actually in my neighborhood in Falls Church, Virginia, which is just a little bit west of here, directly west of here. Just absorb what you see. And then tell me what you think reflects of our culture and our values here in the United States. Does anybody want to call out?
No, safe for that mom to be pushing the baby in the stroller.
Definitely not safe. What does it say about our culture and our values?
So activity and getting the mom out.
Yep, yeah. There's no sidewalk. Yeah, that's definitely something we forgot.
Maybe it's inhaling air pollution.
Baby is inhaling air pollution.
The entire second road going the same place before you have a sidewalk.
You know, that's so cool, right? there's a road, we call them service lanes or access roads. It's kind of common in Maryland and Virginia around the DC area. It's so that the people living next to or the businesses next to the road don't have to. So it's kind of good in that there doesn't have to be a ton of like little driveways coming into this major road, but it's not good because then there's like 6 roads to cross when you're trying to get across the street. I'll also add there's a park on the right-hand side of the picture. And so if you live on this side of the road, do you think that anybody lets their kids go to that park? No, because there's no protected crossing. There's no light that protects kids from cross to get to the park. So there is a green space, but it is inaccessible unless you live on the same side of the road. So how do we get from this, which is everywhere, to those list of things that I was just talking about? So my role in Fairfax County is as an ambassador for health to other agencies who are making decisions about the built environment and about essentially how our world is going to be shaped and the opportunities that people have to get around, types of housing that they have opportunities to live in, and how our land is used. And so I provide education and framing on health issues and the health impacts of the decisions that are being made, the plans that are being written. I bring data and information, often with an equity lens, to look at the differences in different parts of our county by census tract of how well people are doing in certain parts of our county versus others, and the access they have to opportunities for health. We have a lot of healthcare, so that's not as much of an issue, except on the cost and insurance side. It's really about the physical barriers, the transportation options. People have to even get to healthcare, let alone to other things that we know they need to be healthy, like the grocery store. Bringing examples from other places, particularly other counties that look like Fairfax County, so Montgomery County in Maryland, or King County in Washington State, other big urban counties that have complex issues, complex and diverse populations, How are they addressing similar challenges to what we have? So I illustrate that to my colleagues in transportation and planning, housing, public works, et cetera, and talk about how we can model or replicate or adapt some of those practices in our part of the world. And I collaborate with them on projects, plans, and policies as they develop. So rather than waiting till the planning department develops a plan and puts it out there and then responding to it, I'm actually working with them in the drafting phase. And so, I'm working within government. Advocates are working outside of government. They don't necessarily see drafts until they're ready to be put out there or until the officials think that they're ready to be put out there. But I'm able to kind of work with them while we're thinking of the ideas, while we're developing the parameters or the frameworks for what a plan or policy might look like, and try to bring that health perspective informed by data into how they're shaping that plan or policy. So I'm the first person to have this position in Fairfax County. There's, a fair number of us around the country, but it's certainly not a common type of job. It's going to be found more in larger health departments or larger counties like Fairfax. I joined in 2018. I spent a lot of time essentially doing informational interviews with people across the county, and then participated in policy and plan making across the county, did a walkability project sponsored by the Virginia Department of Health, a couple of different magisterial districts in the county, contributed to our climate plan, brought that, I was the health stakeholder in the development of our climate plan, the Resilient Fairfax plan. And I'm currently working on bicycle and pedestrian safety and the first health element in our comprehensive plan. So last two slides, these are all the people that I have established partnerships with. And I would definitely encourage you all to be establishing very similar partnerships in your local community from bringing the message that you want to bring to them. So planning, urban planning and zoning, transportation, all these folks, and then of course the nonprofit sphere as well. HOAs are a huge stakeholder. So if you are part of an HOA, they are very loud. They can be very loud. They can be very NIMBY, but they can be very loud. So these are some very specific actions that I was thinking about that you could take in your local community to push for adaptation, push for a change in how they are doing policy. So learn about planning and zoning, what they are, how it works in your community, learn some planning terminology that'll go far. Sign up for alerts about plan amendments or plan studies and zoning cases that are going on so you hear about them. And there's always a transportation component to this, always. So if you're building a new thing or you're changing a church into an office building, there's going to be a transportation impact. Churches have business on Sundays. Commercial sites have businesses usually 5 to 7 days a week. There's going to be a transportation impact. They might try to widen the road, change the orientation of the intersection. Is there an upcoming new or expanded hospital project? If you are associated with a hospital, if they're building a new building, they're going to build a parking lot, a parking garage. They might be adding a whole traffic lane outside the hospital, widening the intersection. Do you want that to happen? No, we don't want that to happen. Involve yourself in that project and push for those, for the more sustainable option. Staying the course. Let's keep things as they are. Get better bus connectivity to the hospital. Get better networks to help, with people who give rides to other people. All of that. And then leverage your position in medicine and public health to call for safety measures on the streets in your community. In Fairfax County, 172 people are hit by cars every year as a pedestrian. 16 people die on average, but out of the 172, 16 people die. There's a big chunk of people who can't walk again, who have permanent brain damage, who have other very severe impacts from being hit by a car. They lived, they're not a statistic, but ruin their life. So these deaths and these severe injuries are completely unacceptable and completely avoidable, just like the heat deaths that we heard about earlier, completely avoidable.
everyone, and thank you so much for inviting me here today. I'm Sheila Somashekhar. I'm director of the Purple Line Corridor Coalition, which is a project at the University of Maryland's National Center for Smart Growth. And we're focused on a new transit line that's under construction in the Maryland suburbs of DC and how to harness this opportunity. It's an almost $10 billion investment in our state. How do we harness this opportunity for the greatest and most equitable benefits to the communities along the line? So for those of you who are not from the area, I just want to quickly orient you to what the Purple Line is. I love that picture on the right. It gives me a sense for where we're going to be right now. It's a lot of construction and dust. The project is under construction and it's expected to be completed by late 2027. But you can see here the DC rail system was designed to get people from the suburbs into the city and back. It wasn't really designed to get people from the suburbs to the suburbs. And what that means is, as you kind of go into the suburbs here, there are areas like Bethesda on the western end of the Purple Line that have had Metro service for a really long time and have had, waves of investment that make it now a very affluent and expensive community to live in. But as you kind of go in between those spokes of the Metro system, there are areas that are underserved by transit. Whether by coincidence or by design, a lot of those communities are historically disinvested, majority people of color, and the communities are going to see transformative investment in their communities. And so the Purple Line, I live kind of smack dab in the middle of that part right there, right by the Long Branch station. If I want to get into DC, I have to find my way to the Red Line, go down, you have to go back down into the city and back up. It's a very inconvenient kind of way for me to use the rail system. The Purple Line is meant to remedy to create this east-west connection in these growing suburbs, connecting people to economic centers, driving transformative investment in communities that haven't seen those waves before, and getting cars off the road and improving air quality, all the things that we care about and have been talking about. That's the vision. That's the hope for the Purple Line. At the same time, the Purple Line is home to 180,000 people, give or take. 2/3 of them people of color. Again, some of the communities along the line have had the most affordable rents and affordable commercial space in the region, not because it's protected, but because these areas have not been hit by some of the market pressures that other parts had. So that's really the essence. That's the impetus for my work every day. And what's at stake? Amazing restaurants, tucked into strip malls. If you don't know the DC area, I encourage you to get out of DC too. DC is amazing, but some of the best food in the region is tucked into nondescript strip malls in the suburbs. You've got housing stock that, in dense kind of bustling neighborhoods, you've got areas that really offer a sense of belonging and home to the people who live in the communities along the line. And so when we think about transit and the kind of changes it could bring, there are changes you want, and there are also things that you want to preserve. And so this is the essence of my job, is building collective will. When you put transit into a community, there are changes that will likely happen. We know from research that transit will drive up land values, and there are benefits in terms of mobility. But to get equitable outcomes and to make sure that people are able to benefit from a transit project, that's not really built into our systems. And so the Purple Line Corridor Coalition exists to bring people together. Anna had mentioned all the stakeholders that she thinks needs to be involved. We work with community groups, public agencies, elected officials. Kaiser Permanente is at our table. I'll just say that to this audience. It's incredibly powerful to have a healthcare system at our table, investing both dollars and their credibility and voice to the issues that we work on. We convene folks and we say, how do we advance affordable housing? How do we support small businesses? How do we get pedestrian investments how do we make the Purple Line work? Our suburbs were not designed for people. They were designed for cars. How do we help usher in the kinds of transformation that will make the Purple Line work for community? Our convening looks different. It's gotten more sophisticated over time. We've done events at churches, we've done trainings on on how to participate in our region's housing and planning systems. We've created a coloring book that community groups are using to engage people in conversation about the changes that are coming to their community. Oops, wait, hold on. I am moving right here. Let me start here. Okay, everybody has their dangerous image, their dangerous roads image. This is mine. This is Riverdale, which is in Prince George's County. This is, I think, one of the most iconic pieces of infrastructure that are coming into the Purple Line. Most of the Purple Line is kind of traveling on roads and at grade. This is a really cool piece of infrastructure. And tucked behind it, you've got an aging strip mall, but you've got really, again, amazing food. This is the nexus of 4 different residential communities. And people are very excited about what this underpass area could be. But as you can see, it's a very difficult, if you just put a Purple Line station here, it's actually, there's a lot of risk that people are, yes, exactly. I see Anna's face. That's exactly the right reaction. There's a lot that needs to happen, and the counties and the state are trying, but there is a lot of work that needs to be done to make this work. I love my friends, the engineers, working on the sidewalks and roadways and the improvements, but many of them haven't gotten out to the Purple Line. They haven't walked these streets and sidewalks, and so we have organized community walks in kind of key areas of the corridor to say, okay, you've got your plans and your math that you've done. This is what the experience actually is of walking through these communities. Let's bring community members and decision makers together and do a walk through. And it's remarkable the calls that get made about non-functioning signals and things like that when you actually get the decision makers on site. So it's sort of a tactical tool meant to lift up sort of the needs in the area and hopefully push for greater action and investment in the long term. There's a lot that we're doing in the area of housing. This is just an example. We have a developer on our side of the equation. We have someone that we contract with who provides technical assistance to different kinds of projects that are seeking help, that want to help us achieve some of our goals around affordable housing. Our goal with housing is no net loss of homes that are affordable to households earning below $72,000 a year, which in the DC area right now is about 50% of area median income. And so we have been infusing different projects with support. It might be a market rate developer that is putting a project in, doesn't know anything about affordable housing. How do this person is very persistent, our housing development consultant. She'll call them and say, how do we, I can help you package the financing to get and make the numbers work to be able to get affordable housing happen. The Leland is an example of a 15-unit building in the city of Tacoma Park where the tenants wanted to buy their building, and they exercised their right to purchase, but they're tenants, they're artists and teachers, and they're not developers. And so she along with a few others from the city and from a nonprofit in the area have been really offering deep support to help them purchase their building, invest in energy improvements and renovations, hundreds of thousands of dollars, and also supported a growing movement of tenants who want to buy their buildings, helping the city establish a $500,000 fund to support tenant purchase. I feel like I could keep talking. I could tell you about, there's a slide that I don't see here, but there's one about right of first refusal. It's a really important tool. It's become an important tool in Prince George's County, in part because of the attention that the Purple Line Corridor Coalition and other housing advocates in the county have brought to the need for housing preservation. There are a number of aging buildings where people are living with mold and decaying conditions, and when again, if you don't do anything, the most likely answer to that problem is that the buildings get razed and hundreds of people get displaced. This right of first refusal puts negotiating power in the hands of the county to say, when a building goes for sale of a certain size, the first right to purchase goes to a group of approved developers that they know that they can negotiate with. And there's a pot of money that goes associated with that actually invest in the buildings themselves. So to me, that's like a seed. It's these are all stories in progress, but that's a seed of the kind of thing that we would love to see transit mean to communities, that transit brings mobility, that it brings investment that helps drive equity and justice as opposed to causing displacement. And that's the crux of what we're trying to make happen. So I'm going to pause there. This is my contact information, but if you want to know more about community engagement, and I also hear you have a Hill Day. And so I'm just going to say, I live in Maryland. Some of you live in states where your legislators, might have an actual voice and what's happening right now. And there's so much that's at stake right now when you're talking about transportation, housing, all of the systems that need to come together to make this work. And so just thank you in advance for pushing for all the things that you all care about, and look forward to talk. If you want to talk about community engagement, I need my breakout.
Thank you so much. And thank you to our speakers for being very efficient and giving us lots of time to break out into discussion so that you all are just having people talk at you all day long. So we are going to break out both virtually and in person. So our virtual folks, I'm speaking to you here, even though you can't see me. We are going to put you all into a breakout, and there are questions that Diana Van Vliet, my wonderful colleague at the Lung Association, is going to help facilitate, and we encourage you to have a robust conversation. In person, we are going to break out. Our panelists are going to be in different parts of the room. And if you would like to learn a little bit more about what they presented on and kind of have that be the frame of the questions we're going to ask, which is, how can the health community be engaged in this process? How can we better center health when it comes to transportation and transit decisions? And then how can we also connect the dots for other people on how health and transit and transportation come together? So if you want to learn more about maybe on a macro level and what's happening in the federal level, please join Benito. Benito, I'm going to put you in this corner. If you want to learn about the local level and how local health departments, local governments can be involved, and I'm going to put you over there. And then Sheila, if you want to learn about transit and some of the more community engagement aspects, I'm going to put you right in the middle over here. And then everyone have your discussions about how we can get the health community involved. And virtual people, thank you so much. And I hope you have robust discussions as well. I know.